Hi, my name is Leanne Leffler. I'm Associate Professor in the College of Nursing here at the University of Arkansas for Medical Sciences. So a nurse scientist is much different than a clinical specialist. It's the science of how to care for people, and there is a lot of science behind that. We don't want to care for people without the evidence to support the care that we're giving. So what I do in my research is I'm federally funded from an agency called the Patient-Centered Outcomes Research Institute, or PCORI, and I'm doing a large health systems grant on older adults with heart failure here at UAMS. In that grant, what we're doing is we're giving all the patients that we recruit for this grant, we're giving them home remote monitoring equipment. Some of the group are connected to UAMS. So they they're connected to our call center, and they have nurses watching over those numbers and values that go across that remote monitoring. And we monitor for blood pressure, for weight, and for oxygen levels in their bloodstream, and also for symptoms or distress. So what we want to learn with this study is we want to learn how to improve self-management of these patients. Do those that get the connected equipment, do they self-manage better than those that get just home equipment that's not connected?
I'm Dominique Dubois. I am a nurse midwife here at UAMS, and I'm a doctoral student in the College of Nursing. So specifically what I'm interested in examining is the impact of structural racism and perceived discrimination on health outcomes, specifically with regard to moms and their babies. I come to this from my own experience as a midwife, working with racial and ethnic minorities who present with different sets of complications and different sets of health issues.
So a day in my life. Well, first of all, I'm a teacher. I teach at UAMS in the graduate school primarily, and in the College of Nursing.
So a day in the life of my lab looks like getting online, so logging into the College of Nursing UAMS system for my classes, which is Blackboard, looking at my assignments, looking what's due, reading what I need to catch up on, doing outside research.
50% of the time I'm a teacher, but 50% of the time I'm a researcher. So the first study is called the Innovative Care of Older Adults with Heart Failure, which is called iCoach. It's our acronym. The second study that we're funded on is a special funding that was given only during this COVID pandemic. It's still using my same population of patients with heart failure here at UAMS, and we're also using the West Tennessee healthcare system, and we're recruiting from both sites. And what we'd like to find out is their use and their experiences with telehealth and in-person patient visits to see their provider or their physician or their nurse practitioner during this COVID pandemic, because you know, when this hit, hardly anybody wanted to go to the doctor, and they didn't want to come into their health system. So a lot of telehealth happened very rapidly and quickly, but there were a lot of problems with it in some areas. Sometimes it worked perfectly, but really we don't know the experiences of patients that have been transitioned to telehealth or that are still doing in-person during this COVID pandemic. So the study that we have is going to compare their satisfaction. Also, it's going to look at their wellness, communication with their providers, their healthcare providers, and also really just the overall quality of care that they feel like they receive during this crazy time.
I feel honored at this opportunity to be mentored by faculty here in the College of Nursing with strong research focuses, and that to me is very exciting as I develop these skills to become a nurse scientist.